And welcome back. In Health News Now, May is Stroke Awareness Month.
And Dr. Rajkamal Khangura from Sutter Medical Center joins us live. And we appreciate you joining us. Important topic. Every second critical after a stroke. So what are the signs and symptoms you or somebody is suffering one? And are the symptoms any different between men and women?
Great question. So May is Stroke Awareness Month, and we know that now we have great treatment for stroke, which is generally a blood clot has traveled to the brain, and we can either break it up with a clot buster or we can remove it using very small tools inside the blood vessels. So the major signs and symptoms of a stroke can be remembered using a quick mnemonic. It's called Be Fast. You want to look to see if there's any difference in someone's balance. You also then want to check to see if there's anything wrong with their eyes. Are they not seeing half the world? Are they not able to perceive some of the world? You might see some asymmetry in their face. That's F. They could have arm weakness. One of their arms is more weak or slumped compared to the other side. And S for speech. You might notice that maybe their speech is garbled or they're not able to speak. And the last letter of the mnemonic is T, which is time. The race to help somebody recover from a stroke and improve their symptoms is time. Time is of critical essence. So call 911 or head to your nearest emergency room.
And those symptoms can be the same for men and women, or are there differences between the two?
Generally, they're the same for men and women.
Yeah. Now, talk about the other risk factors for people, the risk factors that will increase your chances of having a stroke and what people can do to try to prevent this from happening.
Great question. So the biggest thing we can do to prevent stroke is eat a healthy diet, see your doctor regularly, and exercise. Common risk factors include high blood pressure, diabetes, smoking as the major risk factors. As you age, there's slightly higher risk of having stroke, and sometimes an irregular heartbeat that you may not even be aware of can cause a clot that travels to your brain.
So aside from calling 911, is there anything you or somebody you see having a stroke should do immediately to give them the best chance at surviving?
The most important thing is being evaluated in the medical setting. So calling 911 or heading to the nearest emergency room. It's important to know when the patient was last normal. That's very useful for treatment. Nowadays, we can give a medicine through someone's IV to break up the clot, usually within 6 hours, but we can remove the clot from the brain up to 24 hours and sometimes beyond. So it's crucial to know when the patient was last themselves and what they're usually like at home. If they're very functional, if they're already had suffered a stroke and they already have a weakness, these are important things to know.
Yeah, it just makes me think about the people who are at home by themselves. If they can't call 911 themselves, it really hurts their chance at getting the help they need.
Right.
Yeah. All right, doctor, we really appreciate it. A very important conversation. Thanks for joining us this afternoon.
Thanks for having me.